So, if you could tell me your name and what project you're currently involved in.
Sure. My name is Jay Bergeron. I work at Pfizer. I'm currently involved in the ETRIX project, and I've been involved since the beginning.
For you, what is the ultimate driver for adopting open source technologies?
I think there are a couple drivers. I think the first most obvious driver is cost. So it's the idea that potentially you can save on licenses for the software. In principle, that probably isn't the best driver. Typically, there are a lot of costs in terms of maintenance and support that are very equivalent to any software package. Ultimately, the driver should be the types of requirements that a community might be able to resolve and the types of use cases that may be better resolved through a community effort versus an individual effort or a single commercial effort. And for ETRIX, for example, where the use cases of scientists trying to use these data are very diverse, even for similar data sets or the same data sets, what a community approach offers is maybe a higher probability of meeting those diverse, or I should say satisfying those diverse use cases associated with the problems of interest.
How do pharmaceutical companies use systems like TransSmart, for example?
So I can tell you my pharmaceutical company uses a system like TransSmart specifically for exploratory clinical research. And basically, so data that comes from our clinical trials or data that is consumed from external sources that is anonymized and consented for reuse for analysis that's not necessarily associated with the original trial are put into a system, in our case TransSmart, or systems such as TransSmart, where we can manage the clinical endpoint data with associated biomarker data that often comes in separate from the clinical electronic data capture process. And that's the system that's used for supplying the data for these types of analyses.
What do you think are the current gaps in the bioinformatics landscape?
Well, having just walked out of a lecture about standardization and having that being talked about over the past couple days, I think there is a gap in terms of trying to get the data curated in a manner that it can be most effectively used. So typically, the data curation process, especially for clinical information, which is very diverse and very diverse, not only within a single study where there may be hundreds or thousands of clinical variables that may be of interest, but also in terms of diversity across studies. Even studies within the same indication may have a wide variety, even associated with the same standards, may still have a wide variety and diversity in the way that the data is structured and the content that's actually available in the study. And trying to work, especially doing cross-study analyses, doing those types of collective analyses requires a substantial amount of data curation and data preparation. And make anything that can be done to make that step easier, which is probably the most costly step in the process, would be really valuable. And in the end, it is a manual process. And I like to say there may be some opportunity to facilitate that process, but in the current state, manual curation is the state of the art.
In open source, who pays for this curation?
The users of the open source technology pay for the curation. In the best case scenario, if the data sets are of interest to multiple organizations, and this has happened before. This has happened with ourselves and other pharma, where we had an interest in a data set and we're able to work together to pay for this, for the curation of the data set, but ultimately it's on the user. Now, there are some cases that, for example, the Fox Foundation, the Michael J. Fox Foundation, is using TransSmart to supply data to researchers that have interest in their studies. And that's an example where the nonprofit is actually funding the exposure of their data and the supply of their data through a system like Transmart where they've done the curation and they're presenting it out through the application. And that's a great example as well, but ultimately it's going to be the owners of the data that end up being responsible for that, for the curation and for making that data available.
So, and how do we create this environment friendly for data sharing? Is it through initiatives like eTrix?
Well, that's a good question, and I think so. And I'll give you some retrospective over the past couple days. There was a whole panel that discussed how difficult it is to do data sharing. There was, however, there was a person, Mike Barnes, who leads a number of large-scale public-private partnerships, and he basically said, well, actually, really, that's not the problem. We're willing to share our data, and with some control, right? With control in terms of a review board and make sure that the data is used in a way that it was consented for and intended to be used. And I think ultimately that's what's going to drive it, ensuring that the rules are in place for data sets such that when someone goes to a project, presumably with a review board, with examples of what they would like to do with the data so they can get approved, that the rules are very straightforward and the process of getting the approval or denial is done in a rapid manner. And also that the data is available in a way that can be utilized once that decision is made. I think beyond that, you could be looking at maybe a generational change in people's opinions, and it might require that many years to do that. Or maybe, as someone mentioned yesterday, the technology such as blockchain, things that might make, the technology that might provide confidence in terms of how the data can be used while privacy being retained. So that kind of disruptive technology might be a way of providing those types of capabilities to share and reuse data in both, I guess, a multinational sense as well as a larger scale sense.
And you've mentioned you were involved in eTrix from the start, and you are currently involved. What are the successes and lessons from eTrix?
Yeah, so currently, so I am the scientific coordinator of eTrix. I've been the scientific coordinator for since the second year of the project, where he took over for Ian Dix, where he had to change a role within AstraZeneca. And one of the major successes, I think we had one key performance indicator that was part of our description of work that was really about supporting as many projects as we can with the best practices and with the platform that we developed. And over the course of the collaboration, we've seen an acceleration, especially over the last 2 years. Our intent was to essentially impact 40 projects with the collaboration, which we all felt was on the edge of being impossible, even up through the middle of the collaboration. But currently we're running at about 60 that we've been supported, and two additional that I heard about today. Mm-hmm. So we've been able to meet that key performance indicator, and we were able to meet it approximately a year before the project ended. And it's really because we're seeing, again, once the platform was in place, which took some time to build and provide that to the community, and once practices were built around the platform, over the last year and a half, we've seen the platform being used more and more in our best practices, as sometimes even as consulting efforts, being in higher and higher demand. So that's really the 60 project support really sums up eTrix and eTrix success in really one sentence. And any other performance indicator really is secondary to project support and customer support.